Come in.
Hello, my name's Emily. I'm a PA student and I'll be working with you today. Washing my hands. All right, how are you today? It's so nice to meet you. All right, I'm gonna write a few things down and then we'll get started, okay?
Okay.
Blank sheet of paper. My pens are tucked away. Alrighty, are you ready to get started?
Yes.
Okay, what brings you in today?
A headache.
Headache? Can you tell me more about that?
My headache comes and goes every once in a while.
Okay. When did the headache start?
A month ago.
A month ago? And what is the location of your headaches? On your head, obviously, but
Like, more of like in the back.
in the back? And when you do get your headaches, how long do they typically last for?
All day.
All day. Can you explain what the headaches feel like? What kind of pain it is? Is it throbbing? Is it a sharp pain? A dull pain?
Throbbing.
Throbbing. And does anything make your headaches worse?
When loud noises or if I like hurt myself or fall.
Loud noises. And does anything make your headache ever better?
No, not really.
Not really. And do you have any other symptoms when you get your headaches?
No.
No. And does the pain of your headache does it radiate? Does it stay just in the head or does it go anywhere else?
It just stays in the head.
Just in your head. And when you do get the headache, I know you said earlier that they come and go. So that they come and go throughout the day, or they're pretty constant. When you do get the headache,
They come and go through the day.
come and go throughout the day. Okay, and on a scale of 0 to 10, 0 being no pain and 10 being the worst pain, the worst headache you've ever had in your life, can you rate your pain for me of the headache?
6.
A 6? And before this last month, have you ever experienced this before?
No.
No. Okay, so let me just kind of summarize. So you've been getting headaches for about the last month. You feel them in the back of your head when they come. They last all day. It's a throbbing pain. Loud noises make it worse. And if you have any kind of contact like falling or hurting yourself, it makes it worse. And it's about a 6 out of 10, your pain when you get the headache, right?
Mm-hmm.
Okay. Now I'm going to ask you some general questions. Have you had any fever?
Yes.
Yes. Was the fever, was it today when you get the headaches? When were you feeling feverish, or do you feel feverish right now?
No.
No? Okay. Are you having any chills?
No.
Are you feeling fatigued?
No.
No. Are you having any general discomfort?
No.
No. Any general weakness?
Mm-mm.
No. And have you had any recent appetite or weight changes?
No.
No. Okay. Now I'm going to ask you some questions in regards to your headaches. So these questions will be asked, like I said, for pertaining to when you get the headaches. Do you ever experience any dizziness?
No.
No. Any trouble swallowing?
No.
Any trouble speaking?
No.
No. Do you ever have seizures?
No.
Do you ever pass out or lose consciousness?
No.
No. And do you ever have headaches?
Yes.
Yes. Okay. And have you ever experienced any head trauma?
No.
No. Do you ever have any abnormal sensations of burning or tingling?
Mm-mm.
No. Have you ever been paralyzed?
No.
No. Do you ever have any memory loss?
No.
Do you ever have any numbness?
No.
No. Do you ever have any altered movement, altered like states of balance?
Mm-mm.
No. And do you ever experience any altered mental status?
No.
No. Do you ever have any disturbances when you're walking? Problems walking?
No.
No. Do you ever have any tremors?
No.
No. And do you ever have any weakness?
No.
No. Okay, now we're going to move on to some of your past medical history. Have you ever been hospitalized?
Yes.
Yes, for what?
My sprained ankle.
Sprained ankle? Oh, I'm sorry to hear that that happened to you. So it's just a sprained ankle, no broken bones or anything?
Nope.
No, okay. Did you ever have surgery? Have you ever had surgery?
No.
No. Are you up to date on all your shots, childhood shots?
Yes.
Yes. And did you receive a flu shot this year?
Yes.
And do you know what year you had your flu shot in?
2019.
2019. All right. And do you take any prescribed medications?
I take melatonin.
Melatonin. Do you know how many melatonin you take at a time?
1 to 2.
And when do you take melatonin?
Before I go to bed.
Do you take it every night?
Depends.
So just kind of as needed?
Mm-hmm.
Yeah. And do you have any, do you take any vitamins or supplements aside from the melatonin?
Yes.
Yes. What do you take?
I think it's called Purelax or something to help me use the bathroom.
Oh, to help you use the bathroom, okay. Do you know, how often do you take that?
Whenever I get cramps or my stomach hurts.
Okay. Do you have any allergies?
No.
Food allergies?
Mm-mm.
No. Are you allergic to latex?
No.
Alrighty. And any drug allergies?
No.
No. Okay. All right. So now I'm going to ask you some questions about some conditions, and I want you to tell me if you have any of these conditions or if you've ever been diagnosed with any of these conditions, okay?
Okay.
High blood pressure,
No.
diabetes,
No.
high cholesterol,
No.
any heart disease,
No.
have you ever had a heart attack,
No.
ever had a stroke,
No.
and any cancer?
No.
Okay, now we're going to move on to some family questions. Are your parents living?
Yes.
Yes. And can you tell me their ages?
In the 40s.
In their 40s. And do you have any siblings?
Yes.
Yes. Brothers and sisters?
Yes.
Yes. How many brothers?
2.
2 brothers. And how many sisters?
1.
1. Can you tell me their ages?
22, 14, and 8.
And all living, correct?
Yes.
Yes. And do you have any children?
No.
All right. And remember those conditions I was asking you about earlier? I'm going to ask them again, but pertaining to your family. So if any of your family members that I just asked about, so mom, dad, brothers, and sisters, if they've ever been diagnosed with these or have any of these conditions, I want you to tell me, okay?
Okay.
High blood pressure?
No.
No. Diabetes?
No.
High cholesterol?
No.
Any heart disease?
No.
Has anyone ever had a heart attack?
No.
Has anyone ever had a stroke?
No.
No. And does anyone have any cancer?
No.
No. Alrighty. Now I'm going to ask you some social questions. All of these pertain to you. Do you use any tobacco products?
No.
No. Do you drink alcohol?
No.
Do you do any recreational drugs?
No.
No. Can you tell me about your diet?
I don't have one.
You don't have one? What do you typically eat for breakfast?
Cereal.
And what do you typically eat for lunch?
Ramen noodles.
Ramen
fast
noodles.
food.
What do you typically eat for dinner?
Usually we're somewhere, so we stop and get fast food.
Fast food. All right. And can you tell me about exercise that you do?
I do cheer,
You do cheer.
and I do soccer, during the year sometimes.
Okay. And can you tell me about your living situation? Can you tell me who you live with?
I live with my parents.
Your parents. And do you have a job?
No.
No. Are you in school?
Yes.
Yeah. What grade are you in?
I'm going to 6th grade.
Okay. And can you tell me about your finances? Do mom and dad help take care of you?
Yes.
Yeah, they support you.
Yes.
And are you sexually active?
No.
No. All right. Well, I was just practicing taking a history today. So it was very nice meeting you. I'm going to wash my hands. And that's all for today. Thank
Okay.
you.
Bye.